down. Good afternoon, and thanks for joining us for Ask a Legislator with Delegate Joshua Higginbotham. I'm Kelly Caseman, the Executive Director of Think Kids, and we're going to spend the next hour talking with Delegate Higginbotham, who represents the 13th District, West Virginia, which includes parts of Jackson, Mason, and Putnam counties. And we will be checking back on Facebook from time to time during the conversation, so type any questions you have below, and we'll get to them as the conversation progresses. And many thanks to our volunteer, Maddie Lavoie, who is watching our Facebook feed and will be sharing your questions and comments with us. So welcome, Joshua.
Hi, good to be here.
I'm going to share a little bit about your from your biography on the West Virginia Legislature's website before we begin. Sure. So Delegate Higginbotham has been serving the 13th District in the West Virginia House of Delegates since 2016, when he was either 19 or 20 years old.
I was 19 when I won the election, yeah.
He graduated from Polka High, Go Dots, in 2014, and with his BA in History and Political Science in 2017 from the University of Charleston. And he is currently the Vice Chair of the Education Committee in the House of Delegates. So welcome, Joshua. You are still pretty young, but I ask everyone this, so I'm going to ask you, what was it like growing up in West Virginia in the area you're from, and has it changed any since you were a child?
Yeah. So I appreciate you having me here today, but I think growing up in West Virginia was a real treat. You know, all my family's from here, all my friends are here. But unlike a lot of people from the mountain state, I had the chance to travel around the country and around the world as a young person, parts of Israel and Jordan, Europe, all over North America, and getting to see what life is like outside of West Virginia was certainly eye-opening, but I wouldn't call anywhere else home. So Polka is right here in the Kanawha Valley where I'm from, and I couldn't imagine myself living anywhere else.
Wow, wouldn't it be wonderful if we could have all of West Virginia's kids travel the world and get that perspective, kind of that global perspective of how other folks live? That would be great. It would be very expensive, but it would be great. So you've lived in Polka all your life. Your family's still here. Do you feel as if things have changed a little bit since then?
Yeah, I mean, I think we've had a cultural shift over the last 10 years or so. And we're still a conservative state, don't get me wrong, we're very conservative. But I think a lot of people are sort of becoming more national in their view. I think that a lot of people never left the hollers in the 60s, 70s, and 80s, like when my parents were growing up. And so there was that very small town mentality, that rural mentality that a lot of West Virginians have. But now that we have things like social media, a lot of young people are experiencing those cultures and different ideas that beforehand you'd literally have to travel around the world to experience. So I think that West Virginia has certainly changed in the last decade. And I think for the better too. So we're improving as a state slowly.
I agree. So let me ask you our next question. What made you decide to run at the age of 19 for the House of Delegates?
Well, I felt that a lot of young people's beliefs and values weren't being represented. I know far too many people that I went to high school and college with who left the state for an education. They left the state to get a better job. They wanted a better place to live and raise their own families. And so I knew that there was so many people that I know leaving that I had to do something about it. And I felt that some of the older generations weren't giving much opportunity to a lot of young people and focusing on policies that mattered to us. It was all about the culture wars. It was all about the social issues, when really we need better broadband, we need healthcare, we need a better infrastructure, an education system that works for everyone. Those are the issues that young people care about. And that's what I've been fighting for in the legislature.
Yeah, you really had the wherewithal at a very young age to know that's what you want to do. So did you find it intimidating or difficult to run at such a young age?
Yeah, it was. So I actually decided to get involved in politics when I was 11 or 12. And so I went and knocked on doors for John McCain, for Mitt Romney, for Shelley Moore Capito, and then of course, I decided I filed to run right out of high school. I was 18, 19 when I won, and we, it hadn't looked back. I couldn't imagine myself serving really in any other way, but I just knew from a very young age that this is something that I wanted to do as a way of giving back to the state that has given me so much. So it was definitely intimidating being the youngest one in the state by a lot. There were other young people, of course, Sarah Blair at the time, Kayla Kessinger, a few others, and they were really good mentors to me. But looking to the future, I think West Virginia needs more young people in office, and we are going to have to overcome that intimidation factor. So, I'm just trying to be an encouragement and a positive role model for other people who want to serve.
That is a good point, that we kind of need that concerted effort for people to kind of overcome that fear and run for office. So having said that, what was your first session like? Was it warm? Was it, you said that you created some camaraderie with other delegates. Did you find it a bit intimidating, confusing?
All of the above. So it was an extremely sharp learning curve. I just figuring out where the bathrooms were. I mean, the Capitol is such a big building. That was a really big challenge, was simply navigating the process. I was a sophomore in college at the time when I was serving, and it technically counted as my internship credits. Yeah, the speaker had to sign off on my intern hours and stuff. So which was pretty cool to think about. But it was definitely intimidating. My first term, we had a massive teacher strike. We impeached the Supreme Court. We did a lot. And I'm proud of some of the stuff that we've done. But I think that anyone who wants to get involved and serve, they need to spend the first year that they're in office simply sitting back and listening and learning before becoming, a policy expert. I think that the learning process is very important.
Right. Maddie, let's turn to you for a second and see if you have any questions or comments online.
No questions so far, Kelly.
Okay, thanks, Maddie. So how many sessions do you have under your belt now? Is it 6?
5. So it'll be we've probably had 20 special sessions, but yeah, it's every other month now. Yeah, I think each one gets easier and easier now that I know the process pretty well.
So here's a thought-provoking question. What has been your best moment and your greatest challenge?
That's very thought-provoking. My best moment was probably being the swing vote on the charter school bill. So I was actually in Boston at Harvard at the time. I took this 2-semester course on public policy at the Kennedy School. And so I was in Massachusetts when we had the special session for education reform in 2019. And I got a call at midnight from the speaker, the majority leader, and about 10 other people who were in the room, and said, "Josh, we need you to fly back and be the tie-breaking vote for the charter school bill." And so that's what I did. I flew back at 3 a.m. and cast the vote. And so that was probably the most pivotal moment in my political career. I kind of felt like Joe Manchin being the swing vote in the Senate. Very empowering. And then probably the most challenging side was definitely being the youngest, building up legitimacy, having people take me seriously. That's challenging no matter where you're working, no matter where you are in West Virginia. Some people just don't take young folks seriously, and that's a problem. I'm trying to break that stereotype that I'm just riding the skateboard around the Capitol and have my fidget spinner and stuff like a typical millennial, and making sure that people took me seriously was a big challenge for me.
I can see that. We, over the years when we've had, we've taken kids to the legislature to talk with delegates and senators, and some of these kids, which we'll talk about in a little bit, have been profoundly affected by the opioid epidemic. And it would be difficult for, the response. We would often get the response back, you've got to pick yourself up by your bootstraps. And they don't, I think it made the kids feel as if, there was just such a gap of them understanding, the profound impact that kind of living in poverty, living, with child maltreatment, being removed from the home, these sorts of things had on them. And so I do think that we've created a wider divide than perhaps most between our older generations and our younger generations. And there's a hard time understanding where the other's coming from.
Well, and we're an aging state, Kelly. We are the oldest, if one of the oldest, if not the oldest state in the nation. And so you're going to continue to face this generational gap simply because of how quickly the world has changed over the last decade or two. People from some of these older generations may not understand the technology of today. They may not understand the policy needs. And as a Republican, I do consider myself a conservative. I like the whole laissez-faire, let people be people kind of thing. But at a certain point, government has to step in and create good policy to try to fix some of these societal problems like addiction that we're having. It's organizations like yours that are leading the fight on that.
Well, we're trying, but we'll talk about that in a little bit. So let me ask our next question. You are Vice Chair of Education, which is a hot seat. So let's discuss education. Why did you want to be in leadership in this committee, and what is your vision to improve public education?
Sure. So as somebody who went to public schools, I can tell you I wouldn't be where I am in life without a robust public school system. And being somebody who was in college at the time that I was elected and serving in my first term, I think that it was a natural fit for me because I had just gone through the process. I understood what some of the issues were. I was certainly not an expert. I never claimed to be one. But having just experienced the public school system, I knew what issues there were, and felt that as long as I listened to the right people, to the experts, that maybe we can fix some of these problems. So one of my priorities has been school choice. I am a big supporter of public schools. I'm actually in grad school currently. I do eventually want to teach when I find the time. But I think that we need a system that works for everyone, which is, it's an ideal thing to look forward to, but it doesn't work for everyone currently. So I think that having students do what is best for them, whether it's homeschool, private school, or public school, is something that'll really go a long way. And one of the things that I'm also very proud of is we expanded a lot of our wraparound services in the public school system, more therapy for kids, more school nurses, more counselors in the schools. This is what's going to actually move us forward. We can talk about curriculum and academia all day, but if some of these kids don't get the mental help that they need or the health issues that they need addressed, then they're not going to improve their test scores. And schools have to be more than just a place where kids learn to read and write. This is life and death for a lot of them.
Right. I agree with you on everything. Let's dig down a little bit. So one of the concerns that we have at Think Kids, which, everything that has, a pro can have a con, right? And so we talk a lot about local autonomy. And some counties, I'm going to use Putnam as a good example. They've got a great tax base, right?
Yep.
So often they can provide services that other counties can't.
Right.
So my concern is when you start talking about counties in southern West Virginia that don't have that tax base, that can't pass a levy. When we start talking about wraparound services, the question becomes, how do we pay for them, knowing that there's a higher prevalence of some of our worst disparities in those counties?
Yeah. And we actually faced that issue with the bill to increase wraparound services, Kelly, and because we want local control, right? I think everyone likes the concept, but then what happens when you give a county $5 million for wraparound services, but then they spend it on stuff that they don't really need? That's the challenge. And so finding that balance between making sure they have the flexibility that they need with block grants is a big challenge, especially when you're trying to nudge them into actually spending the money on nurses and counselors and therapy for the kids. And it's also hard to find qualified people in these fields to fill these positions. You can throw all the money at it you want, but if we don't have qualified people, then it's kind of a moot point. So yeah.
Yeah, you're exactly right, because we've been talking about mental health care in schools for quite a while now at our organization. And if you don't have the capacity to recruit and retain, it doesn't matter how much money you have.
Yeah.
So yeah, that is a continuing problem. And I think that you're right. I remember years ago when there was really strict oversight from the State Department of Education over the counties, and that didn't work well. And so, it's finding that balance between, giving them the money and then ensuring that it's going.
Well, I subscribe to the theory of problem-driven iterative adaptation. And if you're not familiar with this process, it's that we constantly need to be changing. So there's not one formula that you can set out there and make the school system perfect and it'll be that way forever. Every single year we come back into the session, we might have to undo something that we did beforehand. And everybody in politics says, I've got the silver bullet, I've got the solution, I've got the one size fits all approach. But in reality, it's far more experimental. You have to constantly tweak some of the policies that we have as a state. And, it's never going to be perfect, but it's that constant evolution that's going to make drastic improvements.
I agree. I learn every session. I'll go into session thinking, as an advocate, there's this bill that's going to be a great bill and I hope it moves. And then as it unfolds in committee, I learn another side of the issue that I didn't realize when I was, first championing the bill. And I thought, oh, well, that's really something that, they have to be mindful of when they consider whether or not to pass this bill.
Yeah.
So there's especially in education.
Yes. There's one bill in particular, I don't know if you're familiar with it, but it essentially would make eye screenings a requirement for elementary school kids. So experts in early childhood literacy say that other than traditional learning disabilities, dyslexia, things like that, poor vision is actually one of the leading causes of kids falling behind in early elementary school because they don't know they have bad vision. And I actually had that problem when I was younger, but we fixed it when I was about 7. And so presenting this bill to our committee and trying to get it to move across the finish line, I mean, you'd think, oh, that makes a lot of sense. But then you really get into the nitty gritty and people start talking about, well, how do you implement it? And that's the big thing that I've learned in policy is it's not just who has the best ideas that make it across the finish line. It's who can market it and show that it can be implemented fully and effectively. So Kelly, you're absolutely right. There's so much more to policy making than just throwing ideas around.
It's a great point. Let's turn to Maddie. Maddie, do we have any questions or comments on Facebook?
No questions yet.
Okay, thanks, Maddie. We must be covering great ground. And so with that, we're going to turn to the opioid epidemic, which is a really difficult issue to undertake. And we've been mired in it for a number of years now, probably, from your team to years at the legislature.
Yeah.
So last year, I'm hoping we can start here and then dig down. Last year, we received, Think Kids, a grant from the Greater Kanawha Valley Foundation to study the effects of the drug crisis in a 6-county area, including Putnam in those 6 counties. And we are looking at it from a ground up approach. So it seems as if for much of the work we've done around the opioid epidemic, it's been very top down. So federal, state, and we're not looking in the communities and asking the communities, what do you need to ensure that kids are getting what they need to, to change the trajectory of their immediate circumstances and maybe thrive and go on to do some good things with their lives. And so we had a lot of listening sessions, a lot of Zoom because of COVID, and surveying. And at any rate, after all of this work, we came up with 5 ideas that could be legislative, maybe not, may be a policy issue, may not be a policy issue. But there were 5 ways that communities thought would be good first steps to ensuring that we're trying to meet the needs of these kids. And they were very different than what I thought we would hear from communities. I thought it would be kind of technical, like the first thing that we would hear, I thought would be, we need more money, which wasn't the first thing that we heard. The first thing that we heard was we need to build our communities back. And so I'm going to throw these 5 at you, and then we can discuss them as an issue themselves and whether or not it can translate into good policy, right? So the first one is, in this moment, we need to collaborate to assess and meet the needs of kids as they transition back to a post-pandemic world. We need more community-based collaboration.
Oh, no, I agree. I agree. I think one of the challenges with living in a rural state like ours is there's not much room to work with different organizations in a community. And in fact, a lot of these rural communities don't have any organizations. The public school and the church are like the only 2 things in the community, whether they offer services or not. So I think we can definitely do something like that in urban areas, but in some of these rural communities, we have to create these community-based programs. And then we can talk about collaborating, but we have to make some of them first. But yeah, I agree.
Yeah, I agree. And if somebody asked me, what do you hear most often when you talk to legislators during session about a particular bill? What I hear often is we hear a lot about a program here, a program there. This is happening to address this kid's health issue. This one is, but it seems as if there's all these siloed programs and no coordinated effort to get them all to work together. I mean, and many of these may be all under the umbrella of DHHR, or they may be under the umbrella of the State Department of Ed. So do you have any recommendations on how to synchronize, perhaps?
Well, I think consolidating certain things would go a long way. We're actually doing a deep dive into Chapter 18 of Code, which I'm heading the task force for, and it's like 500 pages of all the regulations that govern our public education system. And when I'm going through and reading, I mean, this thing is bigger than a Bible. I mean, it's insane how much law governs the school system, and just looking at how many duplicative programs that are out there, how many things that have 10 different agencies or 10 different programs for, you really could just do with one. So I think we have to consolidate some of these programs. That way there's funding all in one place. There's a clear hierarchy of people who's in charge. That way there can be one vision, one direction for stuff like this. So I think that's an important step for us. And whether that would remain under DHHR or something separate, like the Jobs and Hope program that the governor has, that's probably above my pay grade, but we definitely need to consolidate some of the programs.
I agree. And, I've been working with, there was the Aetna MCO program that was created for the foster kid demographic. And we've been talking about the need to centralize all of this information. So just having a place where you can see where all the programs are in a community, and then make sure that we're kind of handing off, if somebody's doing a particular program, we're all shepherding people to that program. And then we're not duplicating efforts, because we don't have enough money to be running multiple programs in the same community.
Oh, you're right.
Okay, so on to number 2. There aren't enough things for kids to do in our communities. And when there are things, families can't afford it or they don't know about it. We need to focus more on supportive, stimulating activities for kids on the community level.
Oh, yeah. Yeah, I'm just outside of Charleston. Polk is 15 minutes from the capital. But even there was nothing to do growing up. And I think that sometimes when people are bored, they turn to addictive substances. They get into trouble, and we've found that here in my community too, where half the time kids are so bored after school, they go out and vandalize stuff, or they'll turn to the wrong crowd and start doing drugs. So I think that this is where economic development comes in, because if you don't have an economy that's doing well, people aren't going to be opening businesses. People aren't going to be starting those things that will occupy kids' times. And so I think you also have to talk about economic development before you can really address something like that. So yeah, I mean, there's 100 different problems to go along with education and children's issues. And so that's something we're trying to address as well.
So would you recommend for these, this 6-county group that we're working with, perhaps we should turn our attentions to like county commissions, mayors, see if we can talk to them about the way we build up these community level programming?
Sure, yeah, the people who are most involved in the community typically is the elected officials. So yeah, more collaboration with them would go a long way. I mean, some of these towns and counties might have their own programs that you and I aren't even familiar with. So I know there's I believe in Jackson County, there's some local initiatives for addiction and for care for stuff like this. So maybe they have that in the 6 counties that you're currently researching. So definitely coordinate with them.
I do, yeah. I'll reference Putnam Wellness, who may or may not be joining us today. They do some activities to get kids active in the community, and then there's Active Southern West Virginia, and they do a lot of kid-specific outdoor adventurous programming. But what we heard, which I think is important, is that this notion that kids who are in these circumstances need to hear more about how they shouldn't do drugs is not what we're looking for. We're looking for things that engage their minds, get them out there and keep them healthy, but also help inspire that sense of community to where they may be giving back, connect with perhaps a senior center, or, because we want them to stay here. And, we see them as an investment in the future, but if they have no way of connecting on a compassionate level, say, there's a good chance that they will leave, or they won't feel that empathy to engage and do things to benefit others within their community.
Sure, yeah. It's not so much of telling them what not to do. I think a lot of young people are, and I still do this sometimes when I'm told not to do something, that makes me want to do it even more. But it's giving kids another option, another outlet to express themselves or to vent, rather than turning to controlled substances. So it's more about giving them other options for entertainment.
I agree. So let's move on. Let me see. We're on number 3. We need pantries and hygiene closets in every school. Some have them, some don't. How can we ensure and sustain them in every school in the state?
Oh, I agree. So the issue is these are all volunteer driven. And there's plenty of food out there. That's the thing. There's not, rarely is there ever actually a food shortage. But in a place like West Virginia, unless these food pantries have partnered with a local church or a local, nonprofit, there's actually no tax incentive for a grocery store like Kroger or an individual to donate food to this supply closet or food closet, whatever we're calling it. I actually had a bill to reform our backpack program system in the state to provide a special exemption in the tax code for these essentially unofficial organizations, because these are not chartered entities. These are not actual nonprofits with boards. It's literally a closet or an extra room where teachers and students get food for the backpack programs. And so In some cases, it's actually more profitable for a company like Walmart or Kroger or Food Fair to throw away the food and take it as a loss on their taxes, as opposed to donating to these school systems. Because in a lot of rural communities, there's not one of these food pantries for people to actually donate and get a tax benefit from. So we need to pass that bill. The other thing we need to do is also provide feminine hygiene products in the school system. I couldn't tell you stories of students and teachers who come to me and saying that, some female students won't even show up to school unless they have this. And so that is remarkably affordable. It would cost the taxpayers very little. And again, if you pass my bill, you can make it to where some of these bigger companies would actually get a tax break for donating. But that process just is not in place yet. So if we pass those two bills, I think that would be a really positive step.
I agree. And you brought up a good point that we're learning as all of this is unfolding, as we're doing these community works, is that our state relies heavily on the faith-based community.
Yes.
For a lot of things. And I feel as if we kind of owe them to do some sort of assessing, because I do feel as if often they'll spend money buying food, for example, that could be found in other places, and their money could go towards something else. I mean, I feel as if they're spending their time and resources on duplicative work, that if we just got better at doing, creating that infrastructure, that they could use it, we're not going to run out of need. They could just use it for something that is a gap in services.
Sure. Well, and as a Christian, my church is very involved in the community, and we do stuff like that all the time. But I think that a lot of times we're just looking at the problem that's right in front of us. We're looking at the symptom and not trying to actually fix the root cause of it. And whether it's addiction or hunger-related issues, food insecurity, food deserts, those are symptoms of a bigger problem. And sometimes we in the government and people in the faith-based community are often not looking long-term. And we're only finding solutions to the problem that's directly in front of us, rather than getting to the root cause. So that's something that we need to try to fix. Yeah.
I agree. It's hard with the opioid epidemic, though. It's so convoluted and complex to try it. I feel as if almost every session there are fires that just need put out, right? That thinking long-term becomes very difficult.
Yeah, no, you're right. And I feel that sometimes we focus a bit too much on the culture wars and social issues, and not the actual meat and potato issues that people care about in West Virginia, that actually try to address the problems in this state. So it's something that I'm very passionate about as a policymaker, and something that I think there's a lot of other people, young people in particular at the Capitol, who want to focus on real issues moving forward.
So let me ask you, on the advocacy side of things, what do you think we can do to try and guide the narrative away from the culture war issues?
Well, typically what I do when I'm trying to pass a bill that I have, I will literally walk around the Capitol with an expert or with a witness or somebody who's had to go through life experiencing some of the problems that I'm trying to address. And I will literally go knock on doors in the East Wing and the West Wing and just talk to people. Stuff like this is wonderful, Kelly. This is great, what we're doing now. But I think that those one-on-one meetings with lawmakers really will be effective. And I'll give you an example. So we had a bill that actually died. It was going to die before we even had the chance to vote on it, which would provide, it would make it to where Medicare and Medicaid would cover long-acting reversible contraceptives and the pill and whatnot for needy women, for the impoverished parts of our state. And the bill died. It wasn't going anywhere. It's not like it would cost us a whole lot. So what I did is I flew in the vice president of Bayer Pharmaceuticals, who makes these devices, who makes the pharmaceuticals. And literally, we spent 3 days going door to door in the Capitol, and we convinced people to pass the bill, and it ended up passing 95-5, which is really remarkable considering a week earlier it was dead on arrival. So it's stuff like that that I believe will really move the needle with good policy, and instead of social media just taking the priority for us to get our message out there. It's putting in the elbow grease and knocking on doors that'll really improve the outcomes that we're looking for.
I agree with you. I completely agree. I'm on Twitter a lot, and it's amazing to me how often groups like mine use like Twitter, and I think, how many people are on Twitter? You know, are legislators actually getting that message, or do we really have to go and sit down with them with an expert to try and help?
Well, I'm on Twitter. You know that.
Yes, you're Twitter. Yeah, yeah.
Not,
there are some.
but
Yeah. I think there's Stephen Allen Adams. We had him on a Facebook Live a few weeks ago, and he said, you know, we could put probably all the people in West Virginia who are on Twitter in the same room. And it would have to be a big room, but I think he has a pretty good point. So using social media sounds good, but those 101s, I agree, is really important. So we'll move back. By the way, the pantry and hygiene closet thing, just FYI, seems to really be gaining a lot of ground with our folks. So I'd love to see the bills that you were referencing earlier. The next one is, and nobody's going to say no to this, grandparents need more resources to raise their grandchildren.
Of course.
Yes. So have you worked on this issue? I know that Bonnie Dunn with Healthy Grand Families has been to the legislature a number of times. A good question is this something that has been discussed in the education committee?
Yeah. I mean, you know, I'll give you an example. My nieces and nephews who are in the public school system now, they were homeschooled last year, of course. Almost half of their class has a parent who's in jail, has overdosed, or they're being raised by their grandparents. Half. So we're seeing a tremendous epidemic, not just with addiction, but families that are falling apart and older generations having to raise them. And a lot of that goes back to some of those root causes of our societal problems that we were talking about earlier. And I don't know if there's a perfect policy solution to it, but every time we talk about issues in the school system, we always talk about the home lives, their family lives, and how that is negatively impacting their schoolwork or their mental and physical health. And I don't know if there is a solution. I really don't. I most of the time politicians would, you know, fumble around and just kind of say something fancy to sound like an answer or a solution. But I'm not. I don't know what the answer is to that. And I'm hoping you guys do at your organization.
Well, we're looking at it. You know, I think that I think there's a lot that can happen on the federal level, and I think that I've seen some bills introduced. They haven't moved, but they have been introduced. That really tries to tackle the issue of kind of parents still having control over federal funding mechanisms to feed and care for the kids, but they're, you know, away, and grandparents, you know, they've dropped them off, say, at grandma and grandpa's, and then they've gone and are gone for an extended period of time, and grandma and grandpa are using retirement, or, you know, and then that really gets into, they only have limited resources, and what do we do to ensure that they get what they need, because grandma and grandpa aren't going to, you know, report their kids because they don't want to lose custody of their children, and they're very afraid that if they get into the state system that they'll be gone and they'll never get them back, right? So I think that a lot of that is going to have to happen on the federal level of looking at policy and ways that it can be more adaptive to ensure that the person who's raising the children is getting that funding. But on the state level, you know, I think that Bonnie Dunn and Healthy Grand Families, you know, expanding that program has really helped.
You want to hear a very troubling statistic?
Sure.
It was actually the superintendent of Clayton Birch that told me this a while back. 2019, before the pandemic really hit, we saw about 20,000 reports of abuse and neglect in West Virginia. And that was because of the school system. The teachers would see signs of violence and bruises or whatnot. And then in 2020, the height of the pandemic, we only saw 5,000. So it's not that there were 15,000 fewer. In fact, there's probably much more during the pandemic than there was beforehand. But because kids weren't in the classroom, they didn't see the signs. I think that the pandemic is just going to really make the foster care crisis worse. And so I don't know what the solution is.
I completely agree with you. And that's something we discuss extensively. That's one of the reasons why folks said we need a coordinated effort as we post-pandemic segue. Since 2015 until now, well, until 2019, that's the latest data we've had, West Virginia's seen a 38.5% increase in substantiated child maltreatment cases, so abuse and neglect, which we know is tied to the opioid epidemic. And we know that one of the greatest reporters, mandated reporters that we have are school staff. Mm-hmm. And so you're absolutely right that there is a very good chance we're going to see kids in need of services as they segue back to school. And, what are we going to do to ensure that they have those services and they get what they need? And so that is a very concerning statistics. And again, thank God for these grandparents, right? So, somebody mentioned to me the other day, what are we going to do 20 years from now when it's this generation that's now grandparents and we don't have that safety net to rely on them? If we're really going to act to address the needs of the opioid epidemic, we really have to do it now because we won't have them in 20 years.
Yeah, well, we're going to experience a demographic bubble very shortly. So I'm convinced of that. In fact, we're seeing it in the electorate as well. Next year's election is going to be the first one in history where Gen Z and millennial voters outnumber baby boomer votes.
Really?
Yeah. And so this demographic shift is going to affect all areas of policy, whether it's the issues of the grand families or addiction. You've got a whole new generation coming in that has grown up in a world completely different than older generations. And I don't know if that's a good thing or a bad thing, but it's I don't know what the answer is, like I said.
That's amazing. So do you know the statistics of whether or not they vote?
Not yet. most don't. I'm one of the few. So that's another conversation that we need to try to improve on and change. Nationally, last year, there were more young people that voted percent-wise than any other election on record. So that's a positive thing. I don't know if that transferred down to the state level or not. But in Putnam County, we had like an 86% voter turnout. It was the highest in the state. Right. A normal election would be like 60% in Putnam. So, yeah.
I know that would be really interesting to see. I didn't realize that may change the demographic,
mm-hmm.
And hopefully some of the issues, because of course we would love to see kids' issues become more prevalent as a priority. So here's the last of our 5. And I'd love to hear what you think of this. We need a cabinet position in the governor's office to address children's health and well-being. So all government systems and bureaus that work on these layers of issues are synchronizing their efforts.
I like the idea. This is the first time I've heard that idea. So would we call you Secretary Kelly then, if that's what we're doing?
I didn't say I'd take the job, or it would be offered to me for that matter. But so Governor Caperton had a position, and a couple of other states do. Maryland, for example. I believe Ohio has, we first started talking about this as like a task force, and folks were like, it's too easy to get rid of a task force, especially if you get a new governor in, he can just, on ceremony, or she can unceremoniously kind of get rid of the task force and all that work that you did constructing something can deconstruct. But we would be, if we focused on the drug crisis, it would be kind of a very progressive move. We would be the first in the country. But the impetus for this idea was that, we have these systems. So all of these systems that are affected, or carrying the burden of the opioid epidemic for kids, which is healthcare, foster care, child welfare. I'm going to forget one, the court system, and then I'm forgetting one. At any rate, they all kind of they're very siloed, and so they're all addressing the issues in a different way, using their own resources, their own people, their own personal development, and they're not really building bridges between their silos, which is very interesting because these kids are segueing through these systems fluidly, right? They in and out, that's their lives, but these systems aren't connected. And so that was a way that we thought would be a way to try and address those siloed issues.
I like that idea. I mean, I would have to look more into it, what it would cost, but yeah, I'm pretty sure that would. I don't see any downside to that.
Right.
Some of my colleagues are going to be like, well, you're expanding the size and scope of government. Well, okay, for
Yes.
one position or one new office. But for an area like that, I could definitely see some real benefits to it.
Yes, I think so too. And I think you're exactly right. I think that's exactly what people would say is you're expanding government. We don't need another level of bureaucracy, and to be fair, like you just said, you have policy that is Bible size of just the State Department of Ed. So you're going to have all of these different, but I've been holding policy roundtables around the state since 2016 talking about this issue. We've had leadership from all of these systems sitting, on these panels saying, we really need to break down our silos and work together. And all these years have passed and we haven't broken down those silos. And so I think it's an option. It'll be interesting to kind of, as a group, run it up the flagpole and listen to other legislators and see what they have to say.
Sure. Well, do you have a bill already drafted?
Oh, no.
Yeah.
We're still in the initial, getting our feet wet, shopping it around to see if people are supportive. Of course, we would need the governor's office to support it.
Well, we can override veto anytime. So.
Right. Yeah. So those are our 5 issues. I will segue over to Maddie. Maddie, do we have any questions?
No questions so far, Kelly.
Okay, great. So I have some closing questions for you. What issues or policies are you working on or you have interest in that would be of interest to kids?
We did already pass the Hope Scholarship, the Education Savings Account bill. So I was a lead on that the last 5 years. We ended up going with the Senate version of the bill this past year, but I was able to defend it in the House. And so I think applying that for kids in need is going to be really helpful because it can be used for much more than just textbooks and tuition. It can be used for care for kids with special needs. It can be used for certain devices that help kids learn. It can be used for those specialty services that maybe a traditional homeschool family wouldn't be able to afford, or an expert to help a kid with dyslexia learn to read better. So I think that's going to really, really help a lot of kids in need who may not have the financial wherewithal with their family to afford the kind of educational support that they desperately need. So that's a really important thing. I've been very passionate about that for many years now. But in the public school system, I mentioned the eye screening bill. I think that's going to be really effective. And then, of course, we're working on some tax reform stuff as well. Try to get the economy back up and running in West Virginia to where kids will have something to do again. If you don't have an effective economy, people aren't going to open businesses. people aren't going to provide things to do in some of these rural communities. So, there's never just one bill that'll fix all of West Virginia. It's more like 100 small policy changes that we need to make. But I'm working away, trying to chip at it one day at a time.
Tell me the Hope Scholarship process. So the bill went into effect this month or next month?
Yeah. So it is up and running. The treasurer's office is releasing some of the rules for it. Kids will be able to, parents and kids will be able to apply for it in March of
March of next year.
Yeah. So they have to be a current public school student. So this does not count for people who are currently homeschooled or private schooled. It's just for those kids who couldn't afford to go to private school or whose parents didn't have the ability to homeschool them. So they're kind of stuck in a public school system, which is great for a lot of people. It worked for me. Public schools were wonderful to me, but it's not perfect for everyone. But kids and parents can apply next March, and I guess they would be able to actually qualify to receive the account in the fall of next year. That's when the first semester they would be able to actually utilize it.
Great. We'll need to share that on social media so folks will be sure to know that. Off of topic, you mentioned homeschooling. Have we seen numbers of the increase of kids who are now homeschooled since COVID?
Yeah, I don't have a breakdown of exactly what percentage are homeschooled, but between homeschool and private school, it's about 15% of all the students in our state. So, you're talking, probably 30-some thousand kids, probably about 40,000 kids, I'd say. But it was about 10% pre-pandemic, and now it's about 15%.
Right. It'll be interesting when schools open in the fall if it remains at 15 or if people.
I think a lot of it will be back to normal, just because there's not going to be any, there really won't be any COVID protocols in the public school system anymore.
Right.
Hopefully, cross our fingers.
Yes. Hooray, vaccines.
Yes. Hopefully
Okay, let me. So at Think Kids, we're always eager to get youth and families more involved in the civic process. Do you have any recommendations to improving that activity? I mean, can we get more families involved? What do we have to do to make that happen?
Sure. So I think people just need to be aware that there is a state government. You'd be shocked when I'm going around on the state on the campaign trail, how many people just think that it's the governor and only the governor, and that people don't know that there's a Supreme Court. They don't know that there is a legislature. So I think raising awareness that we exist might go a long way. But making sure that kids who may not come from a family that's politically involved, I think that's pretty important. I that's the way my family was. I'm really the only one who was politically engaged, oddly, from a very young age. My parents, even to this day, don't know how and why that happened. In fact, my grandmother, she voted for the very first time in 2016 when she voted for me.
Oh,
85, yeah. And so that kind of gives you an insight into how politically disengaged my family is. So I think that making sure that we have people like myself or other elected officials going into the school system, raising that awareness to what is out there, and making sure that people know that there's a great need. We rarely fill all of our internships. I mean, people think that it's some exclusive thing that's really, really difficult to work at the Capitol. But I mean, we desperately need help during the legislative session. And then I also bring volunteers. So every session, I probably have 3 or 4 different community people or students at West Virginia State or Marshall or UC come and spend a couple days with me. And while I'm in a committee or at a hearing or in a meeting of some sorts, they can go out and knock on the doors like I was talking about earlier, and build their own network, build their own pool of connections, and get experience. So making sure that we're giving opportunities for these kids to get involved is really important, because we cannot rely on the same 50 people who are lobbyists or activists to continue doing that. We have to engage a new generation. That's what I'm trying to do.
I completely agree. And I find that a lot of people find legislators very intimidating. If they do know there's a legislature, they find them to be very elitist, I guess is the word. But I had no idea that you didn't have interns. We can help advertise for that.
Sure.
Getting more kids engaged in the civic process is incredibly important. So one last question, then we'll turn it over to Maddie and then we'll let you go. If we have folks watching this now or weeks from now on YouTube and they're in your district and have issues or ideas for legislation they'd like to discuss with you, what's the best way to get in contact with you?
Typically social media. So I'm on Facebook, Twitter, Instagram, LinkedIn, and all my contact info is there. I hate to say that I don't check my government email as often as I should, but I get so much spam and junk mail. There was one day during the teacher strike, I actually got 1,500 emails in one day. So usually text me on my cell phone, send me a direct message on Facebook or Twitter or something. That's the best way to reach out to me. And frankly, that's where I get most of my bill ideas, is people sending me an idea and I just call our bill drafting office and we run it. So I'm pretty engaged that way, and always willing to listen and hear people out.
We appreciate that. Maddie, I'm going to turn to you one more time. Do we have questions on Facebook?
No questions, Kelly.
Oh, good. We have no questions, but I think that we will circle back with you, Delegate, because I know that Putnam Wellness Coalition really wanted to work with you today, but they have a teen institute going on and their schedule was very tight. And like me, they had experienced significant technical issues. And so, but we're really eager to get those teens in connecting with you to ask questions and get them engaged. So with that, do you have anything, any parting words you'd like to share?
Well, I just wanted to say thank you both, Kelly and Maddie. I really enjoyed this. I hope anyone who was listening and watching was able to learn a little bit more about the process. And I learned something today as well. I've never even thought of the idea of adding a new cabinet position. So it's conversations like this that will move the needle in the right direction for kids in West Virginia. And don't be a stranger. If anybody has ideas or thoughts or complaints, reach out to me on social media, and I'd be more than happy to work with you and with anybody to try to make West Virginia a better place to live, work, and raise a family. So appreciated you having me on here today.
Well, thanks again, and we appreciate the work that you do. And in a few minutes, we will post Delegate Higginbotham's contact information below the video. So if you'd like to get in touch with him, you can. And we'll also share information from the West Virginia Legislature's website, so you can see when interim committee meetings are scheduled and find connection to other legislators. And so with that, we will post today's video on our YouTube channel tomorrow morning. So feel free to share that with your colleagues and friends. And again, thanks to Delegate Higginbotham, thanks to Maddie, and thanks to everyone who watched, and have a good day.
Thank you.
Bye-bye.
Take care.